sudden heart attacks which are happening post-COVID, young people, passing away in the gym, while at work, in their 20s, in their 30s. Is it related to COVID? Is it related to lifestyle problems? What is the reason this is happening?
35% of deaths in India is due to heart attack related disease. And another very painful thing is 30% of heart attack that occurs in India is below 45 years of age. Young and middle-aged Indians are becoming vulnerable to this heart attack and its related disease. Definitely it's a lifestyle diseases. And if you look at last 15 years, there is nearly 22% increase in the prevalence of heart attack among the youngsters. We have our own study, what is called premature heart attack or heart attack in the young study. So in the last 7 years, we have studied close to 6,000 young heart attack patients. 51% were smokers. And see, if you look at the risk factors from young heart attack group to the old heart attack, there were less diabetes, less high blood pressure among the youngsters. 51% were smokers and 17% had a strong family history. So if somebody in the family has suffered an heart attack before the age of 50, such family members are more prone for heart attack. Interestingly, 25% those who suffer heart attack in the younger population do not have any conventional risk factors. No smoking, no diabetes, and they are fit and fine, and no family history. Here comes the role of stress. Stress today is considered to be a new tobacco. So they have professional stress, they have a stress of, they're thinking about future. And see, the mentality of our younger generation, they're trying to do too many things in a too short time. And they don't believe in going step by step. It's too much of stress. So that is one. And another thing is we are looking at other risk factors, which are not conventional risk factors we know. That is smoking, excessive drinking, diabetes, high blood, physical inactivity, and all those things are known factors, right? And high cholesterol, and food habits have changed, and food products have changed. Today, even female, they were getting some protection against heart disease in the premenopausal age group. That is fading away. What is happening today? Women are also working like men. What you call it as menish women. So except for reproductive cycle, they are exactly working like. And today, children education has become mother's examination.
Yes.
And I think mothers are so much stressed. Even a kid, kindergarten or maybe grade 2, grade 3, and mothers are so tensed when a kid goes for examination. When kids' results are going to be announced, mothers is more stressed. And how many mothers we have seen, at least I can quote some example where they came with history of chest pain, palpitation, headache. And I asked her, we checked everything, it's normal. Then she was telling, no, I am very much stressed because my son has appeared for examination, he did not get good marks. Then asked which I was thinking whether it may be grade 10 or grade 12. Then she was telling LKG. So I think these are stress is playing an havoc, and food habits have changed. Air pollution is emerging as a new risk factor. Air pollution.
Yes.
So I think
you're going to Delhi if you win.
Yeah,
that's going to be something that.
I think last year nearly 20 lakhs people in India have died due to air pollution. See, common man perception is air pollution causes only lung problems.
Yeah.
Bronchitis or some sort of, some chronic obstructive lung disease, something like that. Air pollution is also an important enhancing risk factor for heart attack nowadays. So these are some of the things, and fatty liver, polycystic ovaries, hormonal imbalances, and even some rheumatoid arthritis. I think these are all, but still 15 to 20% do not have, they are fit and fine. Then this thing regarding COVID, see, the prevalence of heart attack among the youngsters was pretty, increasing even pre-COVID also.
Okay.
So post-COVID, during that acute phase of COVID, maybe there was some 5%, 6% increase in the prevalence of heart attack. But that effect lasts only for 1 year, 2 years. And also there was a debate whether vaccine has whether vaccine has increased the incidence of heart attack. According to study, for every 10 lakhs vaccines, the heart attack has happened in only 4 out of every 10 lakhs. That is very insignificant
Minimal,
number.
yes.
I think this is how it has happened. But definitely the food habits, food practices, and the lifestyle and the stress, they are contributing factors.
Click here to watch the full episode.